come here to talk about clinical management, but I will be very much failing in my duty if I don't tell what the biggest problem is. We came with some entomology team, and when we left Sri Lanka, I was told that we are the most important group of people because we are the clinical management people. I told yesterday, probably we are not the most important group of people. It looks like that the entomology team is the most important group of people. So please understand, if anybody wants to find, now who is the person who is capable of stopping this? All of you are now capable of stopping dengue or reducing your dengue, because you can now go and join the team who will inspect for your own sites of breathing places and stop dengue from getting more. Now coming to my topic of telling about dengue fever. Dengue fever is a fever. It's like any viral fever. It is said that if the dengue mosquito bites 10,000 people, the virus gets into the body of 10,000 people, about 9,000 people will not develop any symptoms. So because you haven't got the fever yet, maybe you have been bitten by the mosquito, you have got the virus, you have got infected with the virus, but nothing has happened. And so out of 10,000, 9,000 will have no symptoms, and about 1,000 are the ones who have symptoms by means of fever. But in about half of them, about 500 of them, you will not even know whether the fever is a dengue fever, or this will have no blood test can differentiate whether it is a dengue fever or not. Then only in 500 that you have features which will suggest that this patient is a dengue patient, and of which about a large majority in a normal setting, it should say that out of the balance 500, about 200 will have dengue fever and about 100 will have dengue hemorrhagic fever. I'm not really qualified to say that because we haven't really studied it properly. I generally have a feeling that in your group of that 500, maybe 450 people are having dengue fever and only 50 are having dengue hemorrhagic fever. The dengue hemorrhagic fever is the bad form of dengue, and it is the one that can actually kill the patient. The dengue hemorrhagic fever is the one that can kill the patient, and even in that large majority, those who get, I told you that there is two types of dengue fever called dengue fever and dengue hemorrhagic fever. Out of the group that has dengue hemorrhagic fever, still about 90% of patients will have easy recovery. 90-95% of patients will have easy recovery. Only about maybe 2 to 5% will have more severe disease. If they are not treated well, they can die. So you are by and large having a disease which a majority of patients will get better without many problems. An unnecessary panic is probably not needed at this moment. What we really need is to get the situation under good control so that there is no unnecessary overcrowding in hospitals. You have space for doctors to identify the dengue fever from dengue hemorrhagic fever, and in the dengue hemorrhagic fever group, the group of patients that can go into problems that need specific, more close monitoring and management. You need to create the environment for that by means of preventing the disease. I would rather than say explaining more and more about the disease, if there are any questions at some later stage, I would rather like to answer that. And I think I would like to invite, shall I ask, I think science surgery is the most important thing, Dr. Visinta, who visited the field, who collected samples and saw for himself the two mosquito larvae, tell you about what he saw in your community and actually the places in your surroundings, and they will bite you in the next few days. And actually this may not be the peak of this epidemic, and it can get even worse unless you go and do something and stop it. So may I invite Dr. Visindra to stay for me. Thank you.